understand the functional nutrition approach to reversing IBD, that is inflammatory bowel disease. And I am Manali Chindarkar, the Chief of Research and Development at iThrive. And today we have with us Shayonika Shaw, who is a functional nutritionist at iThrive. Hi, Shayonika.
Hi Manali.
Hi. Yes. So we are going to discuss everything about inflammatory bowel disease to understand it better, its definition, what it actually means, if there are any types to it, and understand its signs and symptoms. And then we'll go to understand its root causes and how it is otherwise conventionally treated. And then we can look at the functional nutrition approach to IBD. Yes.
Yes.
Uh, Shainika also has some case insights. So she had clients who had IBD and we helped them relieve IBD and help them manage their symptoms. So we are going to learn not just theory but also the application part of it. So yes, I'm excited for this live. Okay, so yes, Shanika, would you like to tell us what IBD is?
Yes. So basically, IBD, which means inflammatory bowel disease, is it includes disorders characterized by chronic inflammation in our gut, and it not only the inflammation is not only in few part, but at times it can be an overall inflammation as well.
Yes,
So yeah, so there are two types of IBD. So one is Crohn's disease and other is ulcerative colitis. So Crohn's disease is basically it our gut gets affected in few parts of our intestine,
yes.
and the ulcerative colitis, our complete gut gets inflamed. So
Right.
these are the major difference between these two types.
Yes, yes. So the common point between these, as you said, it is arising out of inflammation. So
Yes.
if we see inflammation in parts, so it is Crohn's disease, and if it has at a stretch, if it is in the continuous form, then
Hmm.
it is ulcerative colitis, right? So it is abbreviated as UC. Okay, so how do we test this? Like, how do we understand that there is inflammation?
So first thing that can we do is our complete blood analysis that we can go for, and then we can go for a GI map test. Through that we can understand that what exactly is happening inside our gut and our intestine. So these two are the major tests that we can go for.
Yes, yes, and mostly when clients come to us, like
Hmm.
I think diagnosis is what doctors do the best. So they diagnose it for us. So there is like imaging techniques like endoscopy, wherein
Right.
we can identify where exactly the inflammation is, and accordingly. And what I'd like to say is the diagnosis is the most important part. It needs to be done correctly, and then we then like start with the interventions. It's not just shooting in the dark. so as
Exactly.
you said, PI map testing, the stool testing is like a really useful tool. We'll come to that.
Yeah.
Before that, what are the signs and symptoms? Like how can one, suspect that they might have IBD?
So, few signs and symptoms can be a it can be a normal pain or diarrhea, fever, fatigue, and there can be weight loss. Significant weight loss can be there. Then there can be nutritional deficiencies because our complete small intestine is affected, which absorbs
Yes.
nutrition. Our absorption capacity will decrease since our intestine is affected. So these are the few symptoms that we can observe if somebody has
Right.
IBD.
Right, absolutely. And the ones that you mentioned when it comes to pain or diarrhea, so it is most commonly like found in all the digestive disorders, right? But we
Right.
need to identify that which type of the digestive disease it is. And mostly people also get confused between IBS and IBD. They think at times they think it is same, but it is not. IBD is inflammatory bowel disease. It has to do with inflammation, whereas irritable bowel syndrome is where the gut is irritated, but it is a set of syndrome and it is not inflammatory in nature. So
Right.
the root cause itself is different, and hence the intervention would also be different.
Yes.
Right. Yes. So when we talk about the two, the Crohn's disease and ulcerative colitis, I would like to tell that. There are three layers in the gut. When we talk about the lumen through which the food passes ahead in the gut, where it gets digested, it gets fermented, and then it gets excreted, and it like the food and all the gut microbiome, all the microorganisms and genes present in the gut, they do their function, right? So there are different layers. So one is lumen through which the food passes. Then there is the mucosal layer where the mucus protein is secreted through it does the initial work of defense, so as to not let any infections inside the body. Then there are intestinal epithelium layers, so I'd like to also show a diagram on this. So we expect these to be intact, wherein the like there is semi permeability. We need only the nutrients and waters and the necessary things to get inside the blood, and not anything that is, toxins or any microorganisms, infectious microorganisms. And then there is lamina propria, and then there is blood circulation. So the anything food or anything harmful, if it has to reach the blood, it has to cross these three layers, right? So the Crohn's disease is the one which affects the intestinal walls, which is the second layer, and the ulcerative colitis mainly it affects the mucosal layer, that is the first layer, right? Uh, yes. Anything you would like to add on this?
Yeah, I would like to add a few more symptoms that we can see in these two other diseases.
Right. Yeah.
So yeah, so Crohn's disease can also lead to blood in stools. Although it is very not very common, but it can lead to blood in stools. It can also lead to abdominal pain, wherein the pain can be an intermittent pain.
Okay.
It won't be a continuous pain. It can be an intermittent pain, in fact. And in ulcerative colitis, whereas it is a continuous pain.
Okay. So they're
Somebody has,
constantly there.
yes.
Okay.
So, and also there might be rectal bleeding as well in ulcerative colitis.
Okay.
Yeah,
So I think ulcerative colitis is mainly to do with the colon,
yes, the
the
colon.
region,
Hmm.
yes, near the rectum, right?
Yeah.
And the Crohn's disease is like anywhere in the large intestine in the discontinuous manner.
Yes.
Yes. Okay. So I think we've got a fair idea about what IBD is, the two
Hmm.
primary types, Crohn's disease and ulcerative colitis, and the signs and symptoms of it. So I'd like to know, in conventional medicine or conventional nutrition, have you come across any dietary interventions that doctors or nutritionists that often recommend for IBD?
See, there can be like doctors generally recommend dairy products like milk for so that our gut heals quickly. But again, milk is also inflammatory in some way or the other, and also there can be like we can include starch. So in starch we can have like whole wheat noodles, or like doctors suggest that whole wheat noodles or tortillas or cereals, these help, but again they have gluten. So
Right.
these are inflammatory products, so they again cause irritation in our gut.
So
And
the foods advised to heal IBD are in itself, they are again troubling and making that IBD constant. Yes.
exactly. And there are again like few fruits and vegetables we should include, like things that are high in fiber.
Right.
Lack of fiber can also cause IBD in our,
Yes. Yes.
yes.
So as you
So
mentioned, as you mentioned, the lack of fiber. So it brings me to the causes part of it. So, like to understand IBD better, I think like any other disease in functional nutrition, we first focus on the root cause, right? We need to
exactly,
identify why IBD has occurred or manifested in any person before going on and giving any template diet or intervention. So let's try and understand a few root causes to IBD. So as you said, fiber could be helpful because if there is lack of fiber, if there is increased intake of processed foods, mainly found in Western diets, it could lead to irritation and inflammation in the gut, and it could give rise to IBD. Any other root cause that you can think of?
There can be many environmental factors as well, like pollution. Pollution can lead to these things, and change in diet, like as you mentioned, the Western diet, which
Yes.
consists most of gluten, like breads and everything.
Processed foods, yes.
Yes, processed foods. Then there can be, access to antibiotics. Like nowadays, if something or the other happens, people take antibiotics. So that
Yes.
can also affect and lead us to an IBD symptom. Also, leaky gut is a syndrome where,
Okay.
yes, leaky gut can also lead to IBD. So all of these are few root causes that can lead to inflammatory bowels and disease.
Yes. So coming to that, when you mentioned leaky gut syndrome, I think it would be a new term for many of us. I think those who have digestive issues, they might have come across, or the doctors might have suspected leaky gut syndrome in them. So I'd like to just share my screen and show you the picture. Yes. Can you see it? Is it visible?
Yes, yes, yes.
Okay. Yes, so here the diagram shows like how leaky gut syndrome looks like what actually happens. So this is the normal gut lining. It is like the healthy condition, which is what we expect. So these are the intestinal epithelial layer cells that I was talking about, and they are tightly bound together. So they are like healthy tight junctions bound together, and there is semi-permeability in between them. So there is like all the food particles, all the digested nutrients, all the water, electrolytes, they will pass through this, and the toxins or anything that is harmful, that will that won't be able to pass into the blood flow. So this is what we expect. And there are also good bacteria which do the defense mechanism. They don't let anything infectious come into the blood lining. Then we have on the right hand side, we have the leaky gut syndrome. So here you can see the main distinguishing factor is the tight junctions. The junctions become loose. So here you can see gaps, right? So they are leaking. So everything passing through the lumen, our food, any like the food which is otherwise tolerated now acts like a food allergen. It creates allergies. Or there are any microorganisms which are disease causing, pathogenic. So they also can enter the blood system and they can create havoc. So as you said, leaky gut syndrome is it's a root cause for okay. Yes, so there are nutrients for it, like there are nutrients zinc, magnesium, calcium, vitamin D, vitamin
Yes.
A, which help keep these tight junctions together. Right? There are also like other lifestyle factors like proper uninterrupted and regular, like sleeping and waking up at the same times. Because sleep has melatonin, like when we sleep, melatonin is a neurotransmitter which promotes sleep, so it also helps keep the junctions tight. So they maintain the semi-permeability. If there is any stressor, if there is any psychological stress, we are overthinking or there is some stressor in our life, again the junctions start becoming loose. So as we always say, stress is inevitable, but we need to learn how to manage it to keep the junctions tight. So this is like a stepping stone. Like if the leaky gut syndrome is, addressed and treated or managed, then the IBD itself can get resolved. Right? Yes. Then I think I would like you to talk about the case that you were going to mention.
Yeah, so the case that I had, so there's this client who was unable to tolerate any of the food items that we were suggesting her. So she was only on eggs and coffee and almonds or berries. So then coffee is again inflammatory, and she was unable to tolerate anything. So then gradually we took her through few tests like the GI map test that I mentioned. So through that we came to know about the food items that her gut was allergic to or which her gut was unable to
Okay.
tolerate. So
Right.
we eliminated those food items and we eliminated all the inflammatory food items as well from her
Okay.
diet. So gradually, with the help of the supplements and proper food that her gut was able to tolerate, gradually she was able to include foods like rice, dal, vegetables, many things she included towards the end of the program. She used to get bloated earlier. Her frequency of bloating was very high, but gradually towards the end of the program, the frequency reduced and she started recovering also faster than before.
Okay.
These were all
So
her symptoms. Yeah.
yeah, so when we think that I am not able to tolerate these foods or we are sensitive to these foods, but as you're saying, it is reversible and it is completely
Yes.
manageable. And there is a high possibility, and not just possibility, it is doable. Can help people again tolerate those foods which are triggering them, right?
Yes.
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 So yeah.
She also used to take alcohol very, she was very reluctant about it. And that is again inflammatory for the gut and harmful for her intestine. And it will hinder
Yes.
the absorption of nutrients as well. So
Yes, it
alcohol
will
was
disturb the
also
gut
not
biome.
in her case.
Right.
Yeah.
Anything else that that was that you could find that wasn't working right for her or was causing IBD? Anything in lifestyle factors or her diet?
The stress that she had due to her work was playing a
Okay.
major role in this. Her sleep was disturbed. Stress was the major factor due to her work and her lifestyle as well. So I guess the stress was mainly affecting her gut health.
Right, right. All right. So stress is there, lifestyle. Another factor is alcohol. So
Alcohol.
the foods that she wasn't used to tolerate earlier now just making by little changes. And I think it's not just trial and error because we did the GI map testing, and I think we also run the food allergy test for her, right?
Right.
Yes.
It's
So
the
that helped us. Yeah.
yeah, you were telling something.
Yeah. So that helped us to identify exactly what is going wrong with her because if we talk about probiotics, right? In many of the digestive issues, we do recommend probiotics, but in cases of SIBO, small intestinal bacterial
Yeah.
overgrowth, it is like it would be counteractive, like it will exacerbate the symptoms. So for that matter, we need to
Yes.
do the diagnosis first and accurately to then start with the interventions. So I'd like to talk a little bit about the GI map testing that we do. So it's like an advanced test. So as a basic step, that is the preliminary step that we go ahead with is like Shayanika said, is the blood test. So it gives us the entire analysis of our blood, of our different organ systems. But the gut test, GI map test, it's a stool test and it is like an advance. So in people where we detect any digestive abnormality or like gut communicates with other organs also. So may it be heart, may it be thyroid, may it be our skin or immune system. So if we suspect any issues with those organ systems, and that is also a good time to go ahead for the GI map testing. And what it basically does is it quantifies and qualifies, it indicates what all microorganisms are there in the gut and how many are there. So the one factor that I would like to mention is zonulin. So zonulin is a marker. It's a protein which gets like secreted in more quantity in cases of leaky gut syndrome. So that is like it can be easily diagnosed. We can identify that, right? So may it be any overgrowth of some bacteria, or may it be like normal good bacteria going down in the values. GI map test is the go-to marker for IBD or any digestive condition for that matter,
Yes.
right?
Yes.
Yes. Okay. Anything else that you'd like to add, Shanika? Any other thing that
Uh,
comes to your mind?
I would like to add that like people think that IBD or IBS these are like not reversible. It's very difficult. Like people stay with it throughout the
Yes.
time. They don't
Yes.
understand what exactly is happening. But I would say that if you feel that there is something which your body is unable to tolerate, you can always go for these tests like GMAP test, and you can just go to the root cause and especially get your blood work done, so that you can
Right.
understand if there is any kind of inflammation in your body. and it's definitely reversible. We have seen cases like that, and it does wonder, like supplements and proper kind of food can definitely heal your gut.
Right, right. And as you said in your case, so elimination to anyone, it sounds scary, or there is some inbuilt resistance because it is something that we do, like additional or something different from our regular routine. But
Right.
what I think, what I understand from your case is that it is highly rewarding. Like it is a matter of, let's say, couple or 3 months until we see the results, and then we try and reintroduce those foods, and then you are able to tolerate it
Yes.
instead of having those foods and triggering your gut all your life. It's better to give those 2 to 3 months to your healing. Give it a
Yes.
try, do your efforts, and yes, it helps us see. So
Yes.
as you mentioned with the diet, I think supplements also, right? So would you like to address something on supplements, like how supplements can help in digestive issues or IBD for that matter?
Like, so for her, she had leaky gut syndrome. So for that, we gave her a supplement. So that
Okay,
supplement gradually healed her gut. That we
right,
could see, like the when she was introducing few food items in her daily diet, gradually her gut became tolerant to those foods.
right, right.
And the essential supplements like magnesium, zinc, vitamin D, B12, all of these supplements also did wonders for her.
Right. So these are like anyway help build the tight junctions, and the one that you mentioned, which was case specific. So it also did
Yes,
that function, and also we this, like not just to do with supplements, but I think we also gave some home remedies or some foods which helped the gut healing, and then we could see the results. So
yes,
there is a
exactly.
like right knowledge and also some adherence, compliance coming from the client side as well. I think which gives us the results,
Yes.
right? Yes, so I think that was it from our side. If you'd like to add anything, Shanika, please go ahead. I'm looking for questions.
Yeah, we
Do we
would
have any
like to
questions?
get a few questions if anybody has.
Yes. I'm not able to see any questions for now. I am not sure if they are there on the other apps, but here I cannot see any. How is IBD different from IBS? Anjali is asking.
Yeah, so as Manali mentioned earlier as well, that IBD is inflammatory bowel disease and IBS is uh, inflammatory bowel syndrome, irritable bowel syndrome. So IBD is a very chronic form, I would say,
Yes.
and IBS is just the symptomatic, where you understand that yes, something is wrong in your gut. Yeah.
Again, it adds on to like people are not able to tolerate particular kinds of foods or particular food groups. I think FODMAPs is the one for IBS, but
Right.
it is not inflammatory in nature, so there is no inflammation and it cannot be diagnosed with endoscopy. And yes, so as Shanika said, I agree with her that IBD is more chronic and severe form, and it can be easily diagnosed with endoscopy because there is inflammation. So it is
Yes.
a disease and not a set of syndromes. So the root cause to it is different. Yes, so Supriya here is asking, are SIBO and IBS symptoms different? So to give, yeah, yes, Chan.
Yeah, so definitely, like SIBO is small intestinal bacterial overgrowth, and IBS is irritable bowel syndrome. So when there is a like when the bad bacteria, there's a overgrowth of these bacteria inside our intestine. So that leads to intolerance, and our absorption levels hinder our body's absorption. So that is basically SIBO. And IBS, as we mentioned earlier, that it's more of a symptomatic kind of thing. Our intolerance and everything to certain kind of food is related with IBS.
Yes, and I think if we talk about the symptoms also, SIBO, because it is bacterial overgrowth, there is a lot of gas production in it, right? So there is a lot of gas production. So the gas comes upside. So it leads to bloating, it leads to gases, burping. And IBS, with IBS, I think we get either constipation or diarrhea, or sometimes it is mixed, like we cannot diagnose it. So I think the symptoms also differ in like there.
Yes.
Yes, then we have the question from Chandra who is asking what foods need to be avoided during IBD.
So first thing is processed foods, and another is alcohol. Alcohol we have to completely avoid. Processed foods also, due to the lack of fiber in it, it causes IBD at times. So these are few things that should be mainly avoided. And otherwise, the inflammatory foods definitely like gluten, seed oils, all of these are definitely necessary for it.
Yes, even I think soy, corn, these are again
Yeah.
inflammatory, seed oils, vegetable oils. And I
Yes.
think while like we came across coffee, right? So as you mentioned, it is not inflammatory in itself, but if you already have like gluten intolerance, if you are sensitive to gluten, then acts like a cross reactant. So you won't understand it. You think coffee is giving you trouble, jittery or hyperactive or digestive symptoms, but it is actually because you are. Uh, can you hear me?
Yes, yes, I can hear you.
Yes. Can you hear me now?
Yes, I can.
Yes. So I was saying, so it is not coffee which is causing problems, but because you are gluten intolerant or sensitive, that is where the coffee cross reacts and coffee is creating trouble because of your gluten in like inability to tolerate gluten.
Right.
Yes. So Paki is asking, are over-the-counter drugs helpful in subsiding the symptoms of IBD?
So, first of all, I would suggest that we should go ahead with our blood test to understand what all deficiencies our body has and if there is some kind of inflammation or not. And then we should, take proper supplements that will heal and that will help us with our micronutrient deficiencies. Over the counter drugs is definitely a no because it will have some kind of additives or chemicals in it. So we wouldn't suggest to have over the counter drugs
Yes, and I
to
think
substitute.
if you're taking it over the counter, you're not also consulting a doctor. So the
Yeah.
one who is like advising you the medicines or supplements, like there is no again absence of right diagnosis, and if they end up giving you probiotics, then again like it could not be that helpful. So we need to understand like what exactly are you taking and like if like in the first place you need to understand if there is IBD or not.
Right.
Yes. Akanksha here asks, are smokers more susceptible to IBD?
Yes, definitely. Smokers are more than others. They are more susceptible to IBD.
Yes, so because of the oxidative stress, like anyways, as a part of natural aging, oxidative stress is being produced in our body. Smoking adds like loads of oxidative stress to our body, and then psychological stress again. So eventually, you are damaging your tight junctions, and it leads to leaky gut syndrome. And I think we all know it, right from our childhood, but we don't understand the mechanism or we don't understand why it is so. But yes, it is again like it is disturbing your system.
Yes.
So yes, okay. I think that was all. Are there any other questions? Any more questions? Yes, Shanika, you'd like to add a concluding remark?
Yeah, so I would say that get your blood work done, understand your body, and understand what it requires. Take proper supplements, proper nutrients for it, and that's it. Like proper food, eliminating all the inflammatory food items can definitely help you with, you know, IBD.
Reverse. Yes. Yes, and like listen to your body and believe that it is possible. Believe that reversing diseases are possible. So yes, like do your bit, and I think we should go ahead and like heal more people, right?
Yes, true.
Okay, it was a nice session with you, Shanika.
Same
Thank
here,
you.
Mina.
Thank you all for attending and for the
Thank you,
beautiful
everyone.
questions.